Mention nuclear technology and many people picture giant cooling towers, radiation suits and disaster movies. The conversation around nuclear technology is often focused on the future. Will Kenya build a nuclear power plant? Will it be safe, and can the country afford it? But what if I told you nuclear technology is already part of everyday life in Kenya? Tonight, we unpack the nuclear technology many Kenyans are already using without even realizing it. Many people have already encountered nuclear technology in hospitals without realizing it.
Medicine is one of the peaceful uses of radioactive material.
Cancer treatment is one of the clearest examples. According to the Ministry of Health, Kenya records between 44,000 and 48,000 new cancer cases every year. Around half of all cancer patients will need radiotherapy at some point during treatment. Radiotherapy uses carefully controlled beams of radiation to damage and destroy cancer cells. It's like using a weed killer on a farm. The goal is to target the unwanted growth without damaging the healthy crop around it.
Radiotherapy is what is commonly known in this country, and it's probably what most people talk about. You lie on a table, and then there's a machine, and this machine is the one that administers the radioactivity to you.
Many doctors also use tiny amounts of radioactive material in scans to see what is happening inside the body. These materials move through the bloodstream and collect in certain organs or tissues. Think of it like dropping a tracking device inside the body.
So in nuclear medicine, we inject the drug into you. We can term the use of radioactive material in medicine as precision medicine. And it's precise because we make the drug in a way that is very specific to the cancer cells. And therefore, whenever we inject you with that radioactive material, we are sure that whatever part of your body has uptaken that material is what will be interpreted as disease. We can be able to diagnose basically every single type of cancer with probably one or two exemptions. To make a radioactive material for the treatment of cancer, let me say I'm making it for breast cancer. I am going to use science and chemistry to be able to formulate the drug in a way that ensures that at least 95 or more % of it is only uptaken by the breast cancer cells. And then the other organ that is going to be involved in the handling of that radioactivity is the organs for excretion. So maybe your kidney or your liver. But all other organs are spared. So the moment we inject you, we are sure that the blood is going to take all the radioactivity that we have injected you and just transmit it to the cancer cells. And remember also the advantage that we are having, because it is specific to cancer cells, but when a patient has cancer, it does not stay in one place sometimes. It is breast, but now that breast cancer cells have spread to some other regions like bone, etc. So when we inject it into your system, it spreads and goes to your breast, but any other place that has these breast cancer cells. So if it is in your bone, this radioactivity will also go to your bone, but only to the breast cancer cells. It's so precise, and we limit the damage to your normal and surrounding cells so much that sometimes the patients forget they are on cancer treatment.
Hospitals are also required to keep strict records on how radioactive materials are stored, transported, used, and eventually disposed of to make sure there is no risk to patients, staff, or the public.
Radioactive material are characterized by something we call half-life. So every single radioactive element that we deal with will have its characteristic half-life. For the radioactive material that we use on a day-to-day basis in this country for diagnosis, the radioactive element within that drug is called fluorine-18. So fluorine-18 has a half-life of 2 hours, or 110 minutes to be exact. So every 110 minutes, the quantity of radioactivity within fluorine-18 reduces by half. Now, when you're talking about radioactive molecule, there's a concept we call the 10-hour half-life. By 10-hour half-life, we mean within 10 half-lives of that molecule, the molecule is considered no longer unsafe to be handled. So if something has a half-life of 2 hours, within 20 hours, it has finished its 10 half-lives, and therefore it's no longer radioactive. Even if you went with a survey meter, which is the instrument that we use to be able to check whether there is radioactivity in the vicinity, you will find that that material is no longer radioactive. The reading would be the same as what you get outside. So for those short half-life material, we just store them within the lab. Like when you finish our work, you store them within the lab, and then the next day they are going to be disposed as normal waste. So they do not pose any danger to the patients or to the public or to anyone. However, we also have other radioactive material that are long-lived. For example, the one that you're using for the treatment of prostate cancer is called lutetium-177, and the half-life is 6.6 days. So it means we need 66 days. If we are to look at the concept of 10 half-lives, we need 66 days to be able to be confident that we can handle these as non-radioactive material. So for those that are not too bulky for us to store, you have dedicated radioactive waste storage rooms within the hospital that deal with this waste. But sometimes the waste can become a lot, especially for busy facilities or when you're dealing with things with half-lives of 60 days. Now you can imagine we're talking about 600 days in terms of the 10 half-lives. In that case now, the Kenya Nuclear Regulatory Authority has a storage facility for radioactive waste, also from hospitals. In the case of nuclear medicine, we actually administer the radioactivity to you. So as a patient, you are the one that becomes radioactive. So it therefore means that every single thing that comes from your body, including your waste, is radioactive. So the concept of decay tanks, or some jurisdictions will call them delay tanks, is to store the patient's waste. So when the patient goes to the washroom, it does not go through the normal sewerage system. It will be held somewhere until it is non-radioactive. Of course, there are engineering mechanisms that have been put in place with detectors to know when it is no longer radioactive, and then it's released into the normal sewer systems. So if we have given you a radioactive molecule that has a long half-life, or it takes a long period of time before it becomes non-radioactive, then we will stay with you at the hospital until we survey you and we know you're safe enough to interact now with other members of the public that were not receiving the treatment.
In terms of cancer treatment, we do what we call calibration for the cancer treatment equipment to ensure that the equipment is going to emit the correct amount of radiation. In terms of ensuring that the hospitals, the doctors and the people working in the hospital are safe, we usually give them what we call a dosimeter. A dosimeter is a gadget that measures the amount of radiation that they absorb during their work during the day. And what happens is there are usually limits that you're not supposed to exceed. So in the event that you exceed those limits, there are measures that are put in place to ensure that now this radiation is not going to affect you.
Nuclear technology is also being used in food and farming. One of the most common examples is food irradiation. Food irradiation exposes food to controlled doses of radiation to kill bacteria, parasites, and insects. The radiation damages the DNA of those harmful organisms, making it harder for them to survive or reproduce. The idea may be worrying to some people, but the food itself doesn't become radioactive. Instead, it stays fresher for longer and is safer to eat.
Where the apples that we have in the supermarkets are irradiated with radiation just to lengthen their lifespan. So for you to be able to know the amount of radiation you're going to irradiate to those apples, we have to do what we call calibration, where you are able to measure the amount of radiation.
That matters in Kenya, where large amounts of fruits or vegetables go bad before reaching the consumer. Luggage scanners at airports are like an X-ray at the hospital, but for your suitcase. They help security officers see what's inside without opening it. The rays pass through bags and are absorbed differently depending on what materials are inside. Dense objects like metal absorbs more radiation and appear differently on the screen. That's how security officers can quickly spot suspicious items without opening every suitcase. And then there are everyday items that people rarely think about. Smoke